Hey everyone, Cards here from ADifficultTruth. Hope everyone had an amazing Thanksgiving Day weekend, filled with lots of food and spending time with friends and family. I know I sure as heck did. We have leftovers for days. And for those of you that were brave enough, hope you survived the Black Friday mob. Funny enough, this is the day after we're supposed to be giving thanks for everything that we have. I guess the irony is completely lost on these people, but the long weekend is over, so we're going to get back into it. Today we're going to be talking about market failure and how that is going to help us build a case for Medicare for all, or a nationalized healthcare system, whatever name you want to call it. To begin, let's define market failure. Market failure is a situation in which the allocation of goods and services by a free market is not efficient, often leading to a net social welfare loss. Market failures can be viewed as scenarios where individuals' pursuit of pure self-interest leads to results that are not efficient, that can be improved upon from the societal point of view. Now, that last part is crucial in building our argument for a nationalized healthcare system. Libertarians, listen up. Wherever there is a market failure, government has to step in. This is why we have public goods and services, the ones that you use and enjoy every day. For example, infrastructure, police, military, firefighters, and any other emergency services. The marketplace just isn't equipped to handle these things efficiently. Imagine if we all had to pay for our own roads, or pay for our own firefighters or police or the private army. I mean, how chaotic and inefficient would that be? It just wouldn't work, and it'd be ridiculous, to be honest. From the Concise Encyclopedia of Economics, quote, most economic arguments for government intervention are based on the idea that the marketplace cannot provide public goods or handle externalities. Externalities occur when one person's actions affect another person's well-being, and the relevant costs and benefits are not reflected in market prices. For example, a positive externality of having a nationalized healthcare system would be people are less likely to get sick and therefore more productive. A negative externality would be a factory polluting the air because it would make people sick and therefore less productive. So the selling point is, well, it's just not economical to have our healthcare system in the hands of the private sector because of all its market failures, which include inelastic demand. As the name suggests, the demand for a good or service remains the same no matter what the price is. You have to have the life-saving procedure, whether it's free or bankruptcy. Externalities. As we've discussed earlier, the market isn't equipped to handle these. An example of a negative externality in our case is people not being as productive because they get sick more often. An example of a positive externality would be herd immunity. Information asymmetry. Doctors essentially know more about the healthcare system than the patients do. Like, for example, the real cost of a procedure or hospital stay, which can encourage supplier-induced demand. Now, I'm not saying that a government-funded system is 100% perfect, beautifully infallible. No, that's not what I'm saying. In fact, there's a lot of details that still need to be fleshed out, but it is still a better system than the one that we have right now. In fact, every single developed country seems to have figured this out except us. If you are an economically conservative person, then you should absolutely be on board with this, because not only does it save money in the long run, but it does produce a better outcome for everyone. This is not just morally sound, but economically sound.
The function of healthcare should be to provide quality care to every man, woman, and child as a right, not to make tens of billions in profits for the insurance companies and the drug companies.
Anyway guys, if you enjoyed the video, don't forget to like, comment, share, and subscribe, and ring the little bell so that you get notifications when our videos go live for you. Make sure you follow us on Twitter at twitter.com/ADifficultTruth. You can like us on Facebook at facebook.com/ADifficultTruthOfficial. You can listen to the podcast at soundcloud.com/ADifficultTruth. And now you can follow us on Twitch at twitch.tv/ADifficultTruth. Come be a part of the conversation. I'll leave all the links in the description below, and I hope to see you guys in the next video. See ya!